Do you know your numbers? Your cholesterol numbers, that is. September is National Cholesterol Education Month, the perfect time to get a checkup and learn what your numbers mean and how to lower your risk. Dr. Kevin Ferentz, chairman of the Department of Family Medicine and lead physician at GBMC Health Partners Primary Care, is joining us this morning. Good morning.
Good morning.
So everybody's worried about having high cholesterol. What does high cholesterol mean?
Yeah, so it's changed pretty dramatically about 4 or 5 years ago. So we used to just focus on total cholesterol and the bad cholesterol, LDL. And now, like I said, 5, 6 years ago, a new model was put in place where you actually have to calculate not just the cholesterol numbers, but what's the person's 10-year risk for the development of heart disease. We care about cholesterol because it's one of the factors that can cause heart disease, but there are others. Do you have diabetes? Are you a smoker? Do you have high blood pressure? So what a doctor is supposed to do now is plug in 9 numbers: age, race, sex. Do you have diabetes? Do you have high blood pressure? What's your systolic blood pressure, the top number? Are you a smoker? Your total cholesterol, and no longer your LDL, but your HDL, your good cholesterol. That throws out a number, and that tells you what your 10-year risk is for the development of heart disease. If it's less than 7.5%, you're not supposed to be treated for high cholesterol.
Interesting. Well, will people be shocked by that and then maybe, say, well, doctor, this seems to be, I think I'm high, put me on something.
Yeah, so I hear that argument all the time, but I tell them, look, I mean, you're paying me for my advice, and I'm telling you that that's the current guideline. Now, if your LDL, no matter what your risk is, if you have diabetes, you need to be on a cholesterol-lowering drug. If you have heart disease, you need to be on a cholesterol-lowering drug. If your LDL is greater than 190, you need to be on a cholesterol-lowering drug, no matter what the risk score comes out. But if your doctor hasn't told you what your risk score is, you can actually download the app yourself. There's many of them on the market. It's ASCVD Risk.
So what are the things that we should be doing and should not be doing to avoid getting to that point anyway?
Well, we should be eating less saturated fat. I mean, Americans eat way too much meat. We should be steering more towards a Mediterranean diet. More fish, more fruits and vegetables, more grains. People think carbs are bad for you, but actually complex carbs are totally fine for people to be eating. And switch to olive oil from the other oils that you may be using.
And then in addition to the food lifestyle changes?
Well, stopping smoking raises your HDL. Smoking is actually the #1 reason why people develop heart disease in America, not their cholesterol. So stopping smoking, exercising, and actually small amounts of alcohol also raise your good cholesterol.
And so the big takeaway from what you're saying here today is if you go to the doctors to get your cholesterol tested and they don't do all of those things that you mentioned, advocate for yourself and ask your doctor about that.
Absolutely. And if they're not doing the risk, if they're not calculating the risk, do it yourself. Calculate your own risk.
Dr. Ferentz, thank you so much.